Senior Vice President of Policy and Advocacy at the Legal Action Center. Ms. Gardner has worked for more than 30 years in the health and social services policy arena as a policy advocate, trainer, and lobbyist. Today, Ms. Gardner will be discussing the Medicaid Reentry Act, another key priority that we believe must be addressed by Congress this year. This bill has bipartisan support and would allow Medicaid payment for medical services offered to an incarcerated individual during the 30-day period preceding the individual's release. To explain in greater detail, I'll now turn it over to you, Ms. Gardner, and welcome.
Thank you very much. I am delighted to be here to talk about the Medicaid Reentry Act. And I would especially like to thank the Senator for his early support for the Medicaid Reentry Act. Part of the discussion about Medicaid and understanding the nature of this law, this 57-year-old law, is understanding that there are provisions that are embedded in Medicaid that the healthcare and other systems have built themselves around, have adapted themselves to since the beginning of Medicaid. And one of the most impactful ones is the inmate exclusion, which essentially means that while people are incarcerated, Medicaid cannot be billed for their care. And their care is primarily the responsibility of the institution that is detaining them, jails or prisons. But because of mass incarceration and also the inextricable link between correctional health and community health, since 80% of people return to their homes, there is a real challenge that the healthcare in the communities and the disparities there are reflected among the correctional population and then back. And so we have seen over the years that when people leave prison and jails, they have significant health issues, including mental health and substance use disorder. So behavioral health issues are very prevalent in this population. A lot of it has to do with the inherent vulnerability of people in making that transition from inside to outside. The overdose risk has always been especially high for individuals coming out of different institutional settings. And the nature of reentry, similar or not similar to discharge planning that we have in hospital, means that people come out, they're unstably housed, their healthcare is in disarray, and we see a churn between jail, shelters, emergency rooms, where we could have a big impact in how we address their healthcare before they leave. And we've seen that with grant funds in different states. In New York, we have seen major improvements in health in the community when individuals are treated for HIV and Hep C before they leave. So we do have a great deal of challenge. And of course, it goes without saying that inherent in the health inequity is the race inequity, Black and brown people being overrepresented at every stage of the criminal legal system, and the systemic racism that also exists in healthcare really makes for a double impact on communities, Black and brown communities. So, and many people are at their most ill, their sickest, they're least connected to services when at arrest, or people ending up being rearrested, reincarcerated because of a lack of care and attention to substance use disorder and mental health needs. And we've especially seen that during COVID. So the Medicaid Reentry Act is an opportunity to improve community health by beginning the work and engagement with individuals prior to release from incarceration. And this is especially critical because it allows organizations in the community to begin working with individuals before they leave and be able to bill for those services before they come back into the community. This also can work for the jail population, where there are shorter stays, but that need for coverage, that time that people are incarcerated in a jail setting, becomes an opportunity to get them connected in a way that they would maybe otherwise not be before they left incarceration. And so Medicaid reentry has enjoyed wide bipartisan support, has enjoyed support from a number of different sectors. There's a lot of support from the criminal legal system, stakeholders. A recent article about the sheriffs in North Carolina, the Sheriff's Association, seeing Medicaid reentry as a real boon to being able to address public safety by addressing people's needs, particularly their behavioral health needs, before they leave. Again, there are many examples of pre-engagement or pre-release engagement that show incredible outcomes, and certain jurisdictions, certain states are now using their waivers to see if they can actually operationalize this critical linkage. But Medicaid Reentry Act, if passed, would be a game changer. It is a modest incremental step that, again, has broad bipartisan support, diverse regional support, and it would have a huge impact on the health outcomes, recidivism, and state and local costs. So this is really a kind of win-win in so many ways. And I definitely would like to conclude with acknowledging Congressman Paul Tonko, who has been champion on this issue as well from the beginning, having observed the work that we have done in New York to try to operationalize the warm handoff between incarceration and community reentry. Thank you for the time to share about this.
Thank you, Ms. Gardner. Next, we have Dr. Sarah Nozel, who sits on the Board of